Our vision is to attain a socially just and empowered communities. As such, we are working with the different organizations and partners so that we can be able to attain this. In this particular program, what we are looking at is to end new HIV infection by 75%. As such, we need to put a number of measures in place. One of the key drivers is lack of correct information on sexual reproductive health. The girls are highly vulnerable in this, and we are taking steps to make sure that they are empowered with the correct information so that they can be able to make good information for their well-being. Another one is lack of essential commodities. So today we are here to empower girls. We've given them information. We've had a number of sensitization and awareness through our programs. And today we are distributing dignity kits through the support of our partners. This has been done and is possible through the support of the Kenya Red Cross Society, which is working with the Global Fund HIV Prevention Program. So this is happy and is a happy moment for the people of Siaya. We want to say we are really grateful to our partners. We are really grateful to the leadership that has enabled this. And we want to call upon all other stakeholders and partners to remember the girl child, to remember that these are the group that is highly vulnerable to new HIV infection. The other objective that we are having is to end teen pregnancy. Just like HIV/AIDS, teen pregnancy is also a result of incorrect information that is there, lack of information on HIV/AIDS, lack of information on sexual reproductive health, also lack of commodities and essential necessities that these girls need. So we are here to bridge the gap actually, and we are calling upon other stakeholders to support this. We are here at Kogelo. Kogelo is one area that has a high number of young girls and boys that are vulnerable. Behind us, the villages behind us, we are having gold mines. So as a result of this activity, youth are lured towards going and spending their time to extract gold. After they get this money, they also lure girls into premarital sex. As a result of this sex and sexual intercourse, we are likely to get new HIV infection. We are likely to get teen pregnancy, and the burden that we are having in the county right now is unbearable. So if we are to have new HIV infection, teen pregnancy, we are going to really suffer as a community, both socially and economically.
I got empowered by Globcom at Nia Vocational Center on mentorship, but at least the packages I've received today with my colleagues are going to help us, since most of us go to some activities that does not bring any sense, like early sexual behaviors, so as we can get these pads, we can get the soaps due to the family challenges we have, because not all families are able to provide all this for us. You find sometimes a girl can go to an extent of selling her body to find money to buy pads. But at least we say thanks to the Globcom organization together with Kenya Red Cross, because at least it has taken us to some step. We have some change and we are so happy.
We are working in Siaya, and Siaya in terms of the HIV burden, we are at 16.2, that is according to 2020 estimates. But then of course there are other surveys that have been done that perhaps it's lower or higher than that number. And of course we were ranked third after, that is Homa Bay and Kisumu. So basically some of the drivers that are fueling this high prevalence that we have in the county are early sexual debut. That is where girls engage in sexual intercourse at a very tender age of as early as 9 years old. So as a program, we also try as much as possible to do the behavior change communication. This is where we engage these girls to just instill some morals and then also help them in terms of delaying their sexual debut. We also have drug and substance abuse as a very key fueling factor in terms of HIV new infections. And this is because of just lack of information and peer pressure that comes as a result of their day-to-day activities. Another that we can mention is gender-based violence. these girls at a very young age, they tend to indulge into a number of risky behaviors, either because of lack of good parental care or they are perhaps in an environment where violence is the order of the day. So as a program, those are some of our key areas that we trial so much, so that we initiate dialogues, we bring the girls together so that we can instill some good morals in them in terms of changing that narrative of behavior change. But then, as a program, we are looking at reducing the HIV prevalence by 75%.